So again, good afternoon to all of you. So let's have a recap of what are the topics that have been discussed as it has been recorded and posted in the MCUBLE. Last time we have the discussion of the topics pertaining to the knowledge management and information technology service, which is considered as one of the functional service department of the Department of Health. And as we proceed accordingly with the before we proceed with the functions of the Knowledge Management and Information Technology Service, or KMITS, of the Department of Health, let's have first primarily the overview and the review of the definition of knowledge management and the knowledge management system. We have defined the knowledge management if we are using a knowledge and it undergone the process of how it's being used accordingly from the knowledge that had been captured, that had been distributed or shared and effectively used by the organization. One of the examples that I have given, I think, in this knowledge management is when a nurse, okay, when a nurse uh, retrieve the information of the patient who had been hospitalized for 1 week, has been hospitalized 1 week ago. And upon review of the information on the health history, on the hospitalization history of the client, the capturing in the definition as part of the process is on how the nurse retrieved it, the knowledge that has been retrieved. And since this will be this information is very important for the healthcare team to prescribe the therapeutic and the treatment regimen. The distribution means that this pertains to the sharing. So thus, the knowledge has been shared to the healthcare team. And this knowledge had been used, the patient's previous hospitalization history have been used effectively on the prescribed treatment of the client who have been admitted in the emergency room or in the hospital. So that is what we call knowledge management. Another example of knowledge management, for example, in a community, in a health center, if we talk about the vaccination history of the child, the nurse can retrieve the data from the database, then the knowledge and information about the child's vaccination history have been shared to the physician, to the pediatrician, and effectively use this knowledge or information on the succeeding schedule of the vaccination or participation of the child in the vaccination program. So when it comes to the knowledge management, we're talking about the process. And the process talks about on how the knowledge had been retrieved, shared, and used effectively. If we talk about knowledge management system, it's on how the knowledge utilize the information technology system. Okay, if it is on how, we're talking about the how, if it is on how it was retrieved, shared and utilized, it's knowledge management. But on how this information had been stored, okay, had been stored, on how the knowledge and information had been processed for protection, on how this knowledge or information had been retrieved using the information technology system, we're talking about the knowledge management system. If we talk about the process, we're talking about the knowledge management. If we talk about the process plus the information technology system, or the process using an information technology platform, that is what we call knowledge management system. Then we have defined also the difference between the information technology and the information technology system. The information technology is the study or use the system. Okay, use of systems such as computers, telecommunication mechanisms on for storing, retrieval, and sharing or sending of information. Again, if we use, okay, if we use to retrieve, okay, if we use to retrieve and if we use to retrieve to store the knowledge using IT system, then that is knowledge management system. If the nurse is about to use the computer, it's about to use the telecommunication platforms, these are information technology. The difference between the information technology system, it's a broader scope of the information technology because we have talked about the system. This concerns on how the organization, okay, how the organization use the information technology, not just only internal, okay, but also on the external agencies. One of the examples that I gave to you in the recorded video discussion about the information technology is that of when the nurse utilize computers in the hospital to store, retrieve, and send information. While if the information from the hospital using a broader scope, software, firmware, and support services that may include transfer or sharing of information from one agency to another agency, we have talking about information technology system. So one example probably that I may emphasize here is, for example, in the processing of pill health. Okay. In the processing of pill health, the contributor of the pill health claims may not proceed personally to the pill health office just to for the hospital to validate the pill health contribution. Now, the hospital personnel, may use the computer, okay, may use the computer if to validate if the client have the records of pill health from the previous hospitalization, and if the client utilize again the computer, okay, utilize again the computer to retrieve the stored information, it's information technology. While the process plus IT system is knowledge management system. While using the use of the system on the storing is the information technology. While in the information technology, for example, if the hospital personnel wish to validate the contribution of the client, if not retrieved from the hospital records or electronic health records, the hospital personnel may validate it outside from the what storage of the information from the pill health. If given the right to access the information from a hospital to the other agency, have utilized these procedures of software, which are the common with the hospital and the field health office, and the compatibility to access specifically this information is the use of the information technology system. We have also identified the knowledge management system as with the factors on the advice, insights, information, practice, technology, people, improvement, and process. So we have mentioned about the information on how the knowledge management process the information, okay, on the store, how it is retrieved, distribute, and used effectively. When it comes to knowledge management and practice, it has emphasized here that the knowledge management is useful. Okay, is useful to specifically apply this in the practice of nursing for storage of information and use of the IT system. The technology itself is the what we call system. Okay, the system that are being used for the storage, for the retrieval, and for the production of information. Knowledge management in connection to people are those who are experts in the manpower who have been oriented on how to use the IT system and at the same time how it process information. Improvement, this may serve as knowledge management directly to have convenience and increase satisfaction of the clients to access information. The knowledge management in connection to the process involves specifically on how it will either shorten the process but at the same time efficient and effective. And when it comes to the knowledge management, this will talk about an advice or medical advice in a remote facility which may not entail a doctor client physical interaction, but the use of the knowledge management can specifically process the transfer and sharing of information. knowledge management when it comes to the insights. Okay, insights is relevant on how the knowledge management may process troubleshooting in terms of problems with the stored information and how to retrieve information. So we have also identified knowledge management on how it will increase customer service and support, boost productivity, it facilitate employee and onboarding, continuous learning, and reduce duplicated knowledge. In the hospital information system, it will facilitate specifically on how the customer are satisfied with service and support. I have set this example on how the knowledge management consider the term access. Okay, easy accessibility, but with the specific protection. When we talk about reduced duplicated knowledge, preventive. We have mentioned that in the recorded video discussion because it will reduce the chances of errors and duplication of information because it controls already the existence of stored information. When it comes to boost productivity, the key term here that we have utilized is all about functionality. Okay, knowledge management may give competencies and skills to the knowledge on how to use the various features of the technology or the use of the platform to facilitate its function for purposes of the effectiveness and efficiency of the operations. When it comes to facilitate employee onboarding and continuous learning, this serve as on how specific knowledge management system can systematize and promote learning when promote learning even in a remote facility, not on a physical or face-to-face mode, but the knowledge management can use this on how to store, retrieve information. So we have discussed that. We have differentiated also information management system between information management system and the knowledge management system. The information management system, it is on how the conversion of data to information because when the data has been retrieved through interview, this data has, if it has been stored, okay, using the hospital information system, entered all those data, it has translated and processed already into information. Because basically, when we have those data, if it has been filled in the form of the name, the age, the gender, the diagnosis. So you have convert data into information. While the knowledge management system pertains to when this information that has been stored, okay, that has been stored had been utilized to the patient's management, care management, or treatment, then that comes in the knowledge management system. So these are the basic difference of the information management system and the knowledge management system. It has also emphasized that in the Knowledge Management and Information Technology Service or KMITS, the establishment of the Department of Health already started at the time of President Corazon Aquino in January 13, 1987 through the mandate of Executive Order number 119, which entitled Reorganizing the Ministry of Health, its attached agency for other purposes. So at the time, they have already processed on the internal arrangement how the use of the information technology can store the knowledge, okay, can store the knowledge through the use of computers. And this is the time that it already started in 1987 onwards, the introduction of technology used in office operations. We have at that time through the executive order, and there is a creation of the management advisory service during that time that this may entail that the staff this is to provide the staff advice and assistance on internal control and management system improvement. This is on how the staff in any of the under the Office of Management Services will effectively store information even though it's not the manual documents that you are seeing, the physical documents that you are seeing, but the knowledge and the information that have been stored into the computer may still consider as a reference on how to protect it, even though you don't have the physical documents with you. That was according to the creation of the Management Advisory Service under the Executive Order 119. And considering the vision of the Knowledge Management and Information Technology Service, or KMITS, if you will search in the Department of Health website, one of the department services of the Department of Health is the Knowledge Management and Information Technology Service. The vision, just the same as from our discussion of the National e-health policy, the knowledge management, as mentioned, as created its mandate of the Executive Order 119, has evolved its vision. It is the use of the information and communications technology to support the universal healthcare. So we are aware of the universal healthcare. When we are about to involve our nurses, when it comes to the universal healthcare, remember, nurses participate, or rather exist, not just only in the hospital facilities, that they exist and contribute their role also in the community level, in the grassroots, through the community health centers. So since nurses have the major role on the universal healthcare, nurses are more and more likely involved in the KMITs, and those who are nurse informaticists are being hired by the Department of Health KMITs, so that to support and to identify nurses at the same time who are skilled, okay, who may have the basic skills and competency on information technology. So there are four reasons on why the KMITs, or the Department of Health KMITs, had been established. Use of the ICT in the universal healthcare, basically, one, to improve healthcare access; two, to improve quality; third, to improve efficiency; and fourth, to promote patient safety and satisfaction. So we have mentioned that to improve the healthcare access, for example, the mother who will be scheduled to deliver her baby here in Manila can still access the information. The healthcare team can still access the information from where he or she rather undergone the prenatal consultations. Unlike if we will not apply the information technology, it will start all over again from her history, from the interview. Unlike that, it will be very timely to know specifically those pertinent information about the patient if the healthcare team, including the nurses, can have the easy accessibility of information to these facilities. ICT supporting universal healthcare may improve quality. Why? Because when the healthcare team retrieves the stored information, it may manage the time. Okay. Second, it will validate information from the interview of the client. We are talking about the reliability. So the quality will be the measure of success in support with the information technology if the treatment regimen are based from the information that have been validated from the stored information using the information technology. Next is the ICT supports universal healthcare to improve efficiency. We are always talking about efficiency, and efficiency is more on the maximization of resources. So it means that, for example, if the nurse who is attending to a client who is about to deliver in the hospital may not anymore subject to the client to a diagnostic exam if the client just recently, few days ago or a week ago, that the client undergone specific diagnostic tests to validate her condition during her pregnancy or few days prior to hospitalization. So it is cost efficient, and maximization of resources may not anymore demand the use of reagents for diagnostic examination. Third is, when it comes to the efficiency, time allotment is not wasted because the client had been prioritized with those results that have been accessed and available to the facilities wherein it has been stored and retrieved by the facility or the nurse themselves. Now, IT supporting universal healthcare helps improve patient safety and satisfaction. So the highest priority when it comes to the discharge of performance of nurses in her responsibilities are definitely patient safety to avoid errors. One area that I have mentioned before is there is no duplication of knowledge and information. So this could be prevented. Okay, if the information has been saved, this could retrieve and access effectively when it is stored and protected through the use of the hospital information system platform. And if all of those records of the client are already stored and protected, then the patient safety could be promoted. Example, when we talk about the client's hypersensitivity reaction, um, the client is in pain, the client is irritable, the client is not responding well at the time of arrival in the emergency room. So how the nurse rather, will promote patient safety on the interventions that will be done to her. Although there is also validity of information on the interview of the client, but for the healthcare team to protect the client specifically on the medication that will be administered to her, if the healthcare team can retrieve the history of hypersensitivity reaction to drugs of the client, then possibly they may not anymore use that type of drug that may cause risk of the client's safety as well. So the information tech when it comes to the improvement of the healthcare access, quality, efficiency, patient safety, and satisfaction, actually, there is no perfect system. There will still issues, there will still problems, there will still be gaps that will be identified. So the vision of the knowledge management and information technology is also to enable the policymakers, providers, individuals, community that is best for health decisions. Okay, so this data and information that had been stored could be useful, meaningful, and relevant. Okay, relevant if this information are being used, okay, appropriately. The data itself could be stored and translate into statistical presentation. Examples, the information that had been stored in most of the hospitals when it comes to maternal deaths can be retrieved and may have statistical presentation on what are the percentage of the maternal mortality on the national level, which will help the policymakers to amend a law or to design, draft a law relevant to maternal mortality. So the law that has been proposed, the amendment that will be done, are the decisions which will improve the healthcare system. So when it comes to the aside from the vision, the knowledge management and information technology system or service rather have this mission. Okay, if on the four areas that have been identified in the mission is to effectively efficiency have been identified and mentioned in the vision. Now the mission is it's putting yourself on your existence today. Okay? Our mission of the use of the information technology is to improve health effectively information or rather healthcare delivery system, administration and management, and in communicating health. So there are three areas that are mentioned here. Effectively use. If we use the term efficiency, maximization of resources. If we use the word effectively, we have measurement of success. Okay? How to measure? There must be indicators. Example, the mission is it uses information and communication technology to improve healthcare delivery. What is the measure? Okay, what is the measure that the hospital improve healthcare delivery? Can we say research? Yes. Can we say results of surveys? Yes. If it increases the level of satisfaction of patients, okay, in that hospital, then that effectively utilize the information technology that have improved the healthcare delivery system. Another uh, another measure of success when it comes to administration and management goes that the client had been or increases also the level of satisfaction when it comes to the processing of billing, when it comes to the pacing of the activities, medical activities from the time of admission at the time of the client had been hospitalized and the client had been discharged. That pertains on the level of satisfaction if it uses the information technology and promote convenience to the client, okay, to the clients on the services rendered. If we talk about improved healthcare delivery system, it increased the patient satisfaction level. If it costs about administration and management, this may not only involve the increased level of satisfaction of the client. Moreover, this may involve also increased level of satisfaction of employees, of nurses, of doctors, of personnel in various departments of the hospital. Because if the operation is smooth, harmonized, synchronized, then the process are being done accordingly on a real time access and reference, then employees are satisfied, they can easily access information, the clients are satisfied because of a shortened but effective processing of the finances at the same time as the care management rendered to the client. It may also facilitate a submission if it is effectively used of the information and communication technology in communicating health. Okay, this pertains. There are some hospitals, if you can still remember the consumer health informatics, okay, even though the client have are not are have been rather, even though the client have been discharged and the client are not attended anymore by the medical and the nursing personnel, the client can still have the access on the basic information pertaining to prevention of complications or for monitoring of the health status. And that pertains to the platform that are being utilized by the client from the hospital, okay, from the hospital of the continuous care rendered outside the hospital or upon discharge. So this consumer health informatics is the effective use of the information technology because of the continuity of care from the hospital facility, from home care or to home care management. So those are the mission of the knowledge management and information technology. Let us now proceed with the general functions of the knowledge management and information technology service. Number one, formulates plans, policies, programs, and standards for management information system and information technology development. When we talk about number one, formulation of planning, policies, programs, and standards. The knowledge management and information service, if we talk about planning, that pertains to the budgeting because infrastructures, platforms, development of various platforms, either M-Health or E-Health. M-Health is mobile health. E-Health is through the use of the electronic health records. Planning is one of the basic function of the DOH. The DOH primarily may focus on the government hospitals, okay, the government hospitals, specifically the DOH referral hospitals, when it comes on how this information technology system could be in place. Most of the private institutions may have the autonomy or choice, okay, or choice what platform to be used as hospital information system. Just the same as for the MCU hospital, which our MCU hospital is using the Bitsbox platform. But for the government to have a more centralized storage of data, the DOH KMITS is the one responsible to plan and to formulate guidelines in the establishment of the platform to be utilized by all government institutions. So how about for the private institutions? For the private institution, as what I've told you, they may utilize a different platform. However, the coordination with private hospitals, the government hospitals are being done so that to facilitate also retrieval of information when it comes to the statistics on the national level. Example, let us identify an issue on how to have a real-time updates on COVID-19 cases, recoveries, and deaths every 4 o'clock in the afternoon. How it will be done? The question is how it will be done. It will start primarily on the planning. It will start primarily on guidelines because of the protection of the clients when it comes to data privacy. And it will process standards by which all the information that had been retrieved will be presented into a statistical and analytical presentation and present it to the public. This may not be retrieved and processed within the 24 hours, but through the use and through the execution of the function of the KMITs, it helped the DOH to have the real-time updates. And it needs a lot of planning if it is on the national or on the regional level. Next, number two, develop and manages rather the management information system for the DOH. Remember, the Department of Health is the central, specifically in NCR, is the central office that are connected to the Department of Health in the regions. So the KMITS is one of the department of DOH that is responsible on how to establish information or management information system that can connect and may connect and can connect to all the DOH regional office so that if there will be centralized information retrieval, it will be on the DOH NCR. So the KMITS is the one that established specifically the information system that will be used by the DOH regional offices. Next, number three. Another general function of the Knowledge Management and Information Technology Service of KMITS is develop and manages information technology infrastructure and services for the DOH, including corporate data and telecommunication services. Okay, the interagency coordination is made possible on the use of the technology when it comes to, for example, the Department of Health, Knowledge Management and Information Technology Service will coordinate with the National Telecommunication Commission. If you have encountered, even in your own mobile phones, that you are receiving basic information on reminders like if there are earthquakes, if there are safety reminders, if there are health reminders, and at the same time, if there are real-time updates on disaster. So how this could be made possible? It is not just sending text messages to all, but basically it will be validated by the Knowledge Management and Information Technology Service. Then it will be coordinated to the National Telecommunication Commission. On the National Telecommunication Commission, it may have a memorandum of understanding to various telecommunication providers, just like the Globe, the Smart, or the other telecommunication companies that will facilitate the sharing or the distribution of information to the majority. Whoever have the mobile phones and have their SIM cards are being used, they will receive those informations or those information rather. So these are the information technology infrastructure and services that includes the coordination with other agencies of the government so that to facilitate information campaign. And this entails on the informatics such as consumer health informatics. Are there any questions so far? Any questions, students? To my discussion and topics are clear? Okay, hearing
Yes
none.
po, din clear po.
Okay, thank you. Hearing none, I will continue with the next general functions of the KMITS. The fourth general function of the knowledge management is it develops and manages health information resources, library resources, and document tracking and archiving services for the DOH. If we say archiving, if we say tracking, if for example, the client or rather the Department of Health may need a 10-year statistical presentation of the cases of tuberculosis. The the Department of Health may need data and statistical analysis on a 10-month analysis of COVID-19 cases, active cases, uh, moderate cases, and mild cases. So this could be archived because it may just facilitate on the platform that are being used by the knowledge management information technology service through the use of the IT system, which is the knowledge management system, where they can store, they can retrieve those information. It could be consolidated, and then in one glimpse, in a real time, it may give us updates of the statistical percentage of those that have been requested. So tracking. That's why it is also very important before we are aware that the contact tracing are being done, okay, are being done physically and manually. So we need manpower for the contact tracing of those that have been contracted with COVID-19 or those who have been exposed with the active case of the COVID-19. However, the difficulty and the risk of the contact tracer are being considered. So that's why the KMITs have designed a platform when it comes to the possibilities on how to trace the person's exposure to close contacts from day 1 up to day 14. So it could be a way of tracking those persons and through the use of an application. So in just one glimpse, it will give us the statistical presentation of those persons, how many persons have been considered as the close contact, what variant, okay, what variant have been identified and validated with the close contacts. What are the majority of close contacts? Where do the majority of close contacts located? So that's why the Department of Health and the local government units can easily decide what are those areas that have been on the zoning. When it comes to the zoning, those that will be subject for lockdown, those will be subject for heightened restrictions. So this could be done in the general functions of number 4. Number 5 is it advises the Secretary of Health, who is Secretary Duque, on matters pertaining to information management service. So, for example, if every time that Secretary Duque will report to the IATF, as member of the IATF, to the President, he will definitely need those information to validate evidence-based data and proof that there is already an improvement with the cases of COVID-19. That's why those information are very necessary. Simply the real-time information are very necessary so that to facilitate the level of quarantine that will be declared accordingly by the IATF. The actually the director of the knowledge management and information technology system under the health facilities and infrastructure development team is our director for Dr. Enrique A. Tayag, PHSAE, FPSMID, CESO 3. So these are the titles of our great director of the KMITS. He's the one responsible for the operations of the knowledge management and information technology service of the Department of Health. I know that he is familiar with you because he has been active in the previous years in the DOH initiative. So now he is into the knowledge management and the information technology service. Now, let us now proceed on we have identified already the general functions of the KMITs. And according to the Department of Health, this is the organizational structure of the KMITs and DOH. Under the Knowledge Management and Information Technology Service, we have we have the Systems and Software Engineering Division, we have the Information Technology and Infrastructure Security Division, and we have the Knowledge Management Division. So it's very obvious that if we talk about System and Software Engineering Division, it is on how the system will work. Okay, how the system will work through the established software application engineering aspect. When we talk about information technology and infrastructure, how the software that has been established will be utilized efficiently and effectively. And the knowledge management division are basically responsible on how those information and content of the established platform will be useful, meaningful, and relevant. Let us start again first, aside from the five general functions of the knowledge management and information technology service, let us have the discussion of the what are the specific functions of the knowledge management and information technology service of the DOH. So as what I have mentioned, formulation of plans, policies, programs, and standards on the following. Okay, on the following. Number one, systems and process improvement. If we talk about systems and process improvement, for example, in a hospital operation, if we talk about systems, these are these are the established uh, processes or established guidelines and procedures through the use of the information technology. So it means if, for example, a government hospital uses a particular health hospital information system platform, then it must also cater all the departments of the hospital, not just only one area that are being established, but since the organizational facility in general rather will use the hospital information system, it must benefit all the departments to measure specifically the effective use of this platform. So the KMITS is the one responsible on the evaluation and continuous improvement of features of the hospital information system that are being used by the established or Department of Health hospitals. Next, the result of the evaluation on the continuous improvement will facilitate the answer in the number two. If there are issues, if there are gaps, if there are problems that have been identified in the operations of the hospital, then the next question is it possible to use a software to improve the systems and procedure? So this could be answered by the KMITs. For example, in the hospital, we don't have the real-time inventory and of stocks of drugs and medicines. So usually it came to a point that the medicines, uh, the medicines have identified already some of the stocks that are expired. If there will be an established platform included as the hospital information system, so possibly the KMITs may integrate or insert a feature that will facilitate inventory and real-time updating of the expiration dates of the medicines and drugs, which may prevent the possibility of reaching its expiration date. And moreover, it must maximize a certain period that these drugs have been used, because this may not be cost efficient if there are many stocks of the drug that have been expired and not maximized or utilized for operations. So this is another development because they have identified those gaps. Number three, establishment and maintenance of information. For example, the hospital already used the specific hospital information system platform according to KMITS. All the government hospitals are using it, but how to maintain its information? How this information will be protected accordingly? So establishing security features of the platform or the system is very important. Maintenance of the information as well, updating of information is part of the maintenance of information. So that's why every time that we have some features, you will just click update. Okay, update. This will update the system. Actually, when you encounter the discussion in the bits box, it started with the Bitsbox 6, Bitsbox 7, now it's Bitsbox 8. Okay, it upgrades the version. And the maintenance of information also are being upgraded for purposes of protection of information. So maintenance. So this may cause allocation of budget because mainly upgrading of the system or the platform with the outsourced provider may entail cost allocation. Number four, communication technology solutions, including related security requirements, management data, information knowledge, source, and systems. The communication knowledge or the ICT solutions includes, we have mentioned that information in the knowledge management, it is the process on how it could be stored, rather, how it could be, how it could be retrieved, how it could be distributed, and how effectively it will be utilized. On these three aspects of the knowledge management, and if we use the knowledge management system, we will have the process plus the IT system. If it is plus the IT system, could we consider this as a solution? Then if it is yes, then this may apply also if it is established, if it is already established and it has the indicators to measure its successful operation, it could be also applicable to other hospitals in the country that are that do not use yet these platforms. So they consider this as communication technology or ICT solutions. Now, let's start first with the sub departments or offices of the knowledge management and information technology. So let's have the systems and software engineering division. So in general, the KMITS is the one that's responsible for plan, organize, formulate policies and standards. But specifically, let's now be specific. The services that are related to the information system planning and specifically on research and development is the systems and software engineering division. For example, when you engage nurses, when you are engage yourselves into research, all at the end of the research, there's always analysis, there's always conclusion, and there is recommendation. Any recommendation that is related to the information technology, for example, is basically the role of the system and software engineering division. For example, problems and issues have been identified specifically on the increased cases of nosocomial infection. And nosocomial infection are defined as the infection that have been acquired during hospitalization. So if there is continuous increase of the hospital hospital nosocomial hospital acquired or nosocomial infection, then it could start with the research on the bridging of the gaps of why it exists, the increase of the nosocomial infection. Can can a software, okay, can a software solution, can a software solution may meet the prevention, the expectations to prevent the hospital acquired infection. So those are being answered, can be answered by the systems and software engineering division. For example, they may suggest a specific mobile application that may determine specifically disinfection schedule. Okay, it could alarm in your mobile phone the schedule of a real time and scheduled synchronized disinfection schedule. All of the staff may specifically perform disinfection and will be alert accordingly to the use of that application to do disinfection to their specific areas. So those are example. The software that are being established is the responsibility wherein it's all on the database design, system analysis, integration, and maintenance. Okay, the next question is, for example, if it will be utilized by the tertiary training hospital, will it be feasible because of the problem with the access of the internet connectivity in that facility? That's another gap. Okay, to improve specifically the operations, a software can be established, a software or a platform can be established to specifically improve the operations of the hospital. So this could be that may fit the setup of the hospital. This could be suggested by the systems and software engineering division. And usually on the national level, the system and software engineering division develops and operates national health information. Uh, are you familiar with the Stay Safe application? The Stay Safe application is where you will register, okay, well, you will register as individual when it comes to your health status. So these are the applications that may basically consider access to individuals, specifically geographical, on the safety of individuals. Even in the Facebook, when there are disasters, okay, that happen, you will just click specific features of the social media platform on I am safe. It may appear that you are safe on your location and informing all your Facebook friends that you are safe. So just a similar software or another database that could be is for the Philippine Red Cross. This has been a topic in the webinar. When you are about to track the registered or certified uh, individuals who may perform the CPR or the basic life support, if it is needed within your area, then you will just click a tracker application and it may track the individuals who is nearest to your area. So that is national health information. Another example that they have is to develop one hospital command. If you we will this will be one of the topics in our nursing informatics. The one hospital command is if it will identify specifically. Nowadays, the problems encountered is hospitals that could be accessible and open for admission. Most of the hospitals now are in full capacity. Now, using the One Hospital Command application, it will facilitate information on what hospital nearest you can accommodate you as well. And if ever those informations may be can will be insufficient, then the application may direct you to a customer hotline. Okay, a customer hotline which the person also or the customer service will respond to you on how to facilitate admissions in some of the nearest hospital. So these are the platforms that have been established, and these are created for the DOH by the KMITs, and that is under the specific functions of the systems and software engineering division. Now let us now proceed with the information technology and infrastructure security division. If we talk about web design, if we talk about database design, if we talk about software applications, that is system and software engineering. But if we talk about operations, okay, the feasibility that this could be cascaded, okay, this could be cascaded on the regions, this could be effectively implemented on the national level. This is the function of the information technology and infrastructure security division. For example, if the purpose is to have the internet or the intranet computer system accessibility in that region, um, there could be limitations. Okay, there could be limitations if there will be no access on the resources when it comes to the internet and the internet computer system, simply because of the chances of the transfer of information using the internet. However, there could be a solution if it is not do the use of the internet. It could be intranet. The intranet could be only within the internal, okay, the internal access of the hospital. So these are the functions of the information technology and infrastructure division. It's all about how it could be sustained. It is on about how the operations, okay, how the operations are going on within the day or the 7 times a week. And this may entail also a division on what are the equipment and the supplies that are needed. Okay, supplies that are needed when it comes to the establishment of the specific operations. Because it is when you establish a hospital information system, it is not just only you will just download, then okay, it could be implemented in the hospital. It may need wires, it may need also connectors, it may need also specific modem. It needs also these are the equipments that could be necessary, and the procurement of this and maintenance of this, the service maintenance of this could be on the information technology and infrastructure security division. We all know that the KMIS in the central office is the one that caters all the DOH regions. But in the DOH regional office, they have also personnel who may attend to them. But to centralize all the maintenance problems, all the procurement issues, it will be centralized in the DOH KMIT's central office in the NCR. So again, if it talks about operation, if it talks about the system upgrade, if it talks about how the network will be effective and how it will be maintained, it's on the information technology and infrastructure security division. Next is we have the knowledge management division. The knowledge management division, obviously that when we define the knowledge management, we have defined it as distribute, utilize, stored, retrieve. So that's why the process of how it will be collected, disseminated, shared, and accessed. This is the main function or the specific function of the knowledge management division. So again, the knowledge management information technology service is the one that formulates plans, policies, standards, and while the system and software engineering division are responsible for designing the database, the web-based software applications, When it comes to the information technology and infrastructure, this refers to the operation, networks, upgrading of systems. Those are the information and technology infrastructure security division. While the knowledge management division is, you will just remember, of collect, disseminate, share, and access. These are the specific functions of this sub-department. So I think that ends up the topic on the knowledge management and information system. So I will stop in this discussion and we'll proceed to the next topic, which is topic 9. The topic 9 is all about the hospital information system. I know you are familiarized with hospital information system because the one that I will utilize in the discussion on our topic is related to what had been considered as a webinar in your laboratory, and that is the use of the Bitsbox. But the discussion that I will be considering is a more brief discussion because it will just entail those features. Okay, those features. It's not the actual operation, but specifically the features of the Bitsbox hospital information system. So let me share again my screen on the hospital information system. Okay. So let's say the hospital information system. So I hope you have learned from the knowledge management system, specifically on the existence of the KMITs. Now we will have the discussion primarily on the hospital information system, specifically on the BITS box. Are you seeing already the slides that have been projected, class? Is
Wala
it,
pa po dito.
wala pa? Okay, so let's, I will project again the slide. So let us now continue our discussion in information system. It's all about the HAS oriented on the BitsBox platform. So I will be that we'll discuss accordingly. This one. Students, can you still hear me?
Yes po, sir.
Okay, so it's loud and clear.
Choppy po din.
Choppy. So I will just fix my audio.